would like to welcome Mr. Naresh Duble, Head Continuous Improvement and Marketing of Knauf Ceiling Solutions. So, over to you, sir.
Yeah, thank you so much. Thank you all for the gift of your time and attention. I have a great pleasure in sharing with you uh, something which is very fundamental when we're talking about new era starting in healthcare. Making Indian healthcare system best in the world, something need to really shift and greater degree of awareness, greater degree of sharing. So hospitals are for the patient. So patient well-being and fast recovery is the core essence why hospital exists as such. So this is the primary aim of all the hospitals, and the future of hospital is no hospitals, right? None of us want to be in a hospital ever for our lifetime. And currently we are talking about designing a building which take care of Panchamabhuta. We studied Ayush, we saw technology. At the end of the day, it is sound, touch, sight, taste, and smell, which has cognitive, psychological, physical effect on our health and well-being to enhance quality of life. So Knauf Group, which is 150 acoustical solutions, hygiene solutions, safety solutions for healthcare. And I'm very sure next 15 minutes will be valuable for you to understand what we are sharing about this. So serene atmosphere and indoor air quality are essence of what we really experience in a healthcare space. And yesterday, my colleague has presented UVC loop vinegar, or innovation in a UVC retrofit solutions in a ready-made hospitals without affecting AHU designing, without over maintenance, without anything, just retrofitting UVC solution to enhance indoor air quality. And there are many other ways you can do that, and many of our products I will touch upon will enhance hygiene factor. But this is something which every hospital should try and have it. And if you're interested us to get in touch with you for a UVC solution, I would request you to put your name and number in the chat or just say yes. I will personally will get in touch with you. Next important thing for a hospital is comfortable working condition. And can you hear the audio?
આવવાનું બોસ આવવાનું હું એ જ ચાલુ કરતો હતો મોબાઈલમાં દેખાય છે આમાં ઓછું દેખાય કરો કામ.
So number one complaint in any hospital is not the design, not the lighting, not the air conditioning, but the sound which is coming into any hospital, which is uncontrolled, annoying, enhancing errors, and reducing satisfaction of the patient who are staying in there. And so this kind of environment doesn't help anyone to really experience hospitals' quality of service at a highest level. So errors are bad in any facility, but imagine those doctors and staffs and patients who are under such tremendous noise in our hospitals. We expect them to perform well. We expect them to deliver wow experience for our patients. We expect them to be best in the industry, but the reality is not like that, because sound affects us cognitively, behaviorally, psychologically. Wherever you are, sound is keep on affecting us. So this is an era which we need to design our buildings, design our hospital facility where we can really impact the quality of sound which we have there. So these are the products which Knauf Armstrong gets to healthcare facility. BioGuard acoustics, BioGuard plane are the world-renowned product used over 40 years across the globe for the best of the best hospital. We have launched that in a metal variety in India, which is antimicrobial, antifungal. So the next important thing when you talk about a hospital is safety and ease of maintenance. Imagine like this: you have water leakage happening, when you have a trap door being a trap, you know, how do you really maintain a hospital? Because leakage is a big problem for any building, but most important, the building like hospitals, where once humidity level goes up, the rate at which bacteria and fungus growth happen is enormous. So people are using a cement sheet, people are using calcium silicate tile, people are using metal tiles to just block the leakage. Without solving the problem of leakage, if you block the leakage, you are making your very dangerous. And this is something which is like a blind spot in our healthcare facility. So why we require a modular acoustical ceiling is a question which I put on the slide, because it gives you an accessibility. It tells you the leakage has happened at the point where the leakage has happened. In this particular building, you never know where the leakage is happening. The blot is flowing from 1 feet to 10 feet distance, and you can't solve something which you don't know, right? So we need to know the leakage. We need to stop the leakage at the source early as possible. So people go for metal sealing, and they make a mistake of using metal perforated sealing, and you have a perforation which collect dust, breed bacteria. Completely no for selection of such materials. And why I'm building this awareness, because there are many hospitals, government hospitals, private hospitals, believes in using, and they are using such kind of material, should be immediately stopped. What we should be using a right material for right application, and stay with me to see those things. I would also touch upon Griha and making your hospital more economical. Now, uh, so human-centric design is the way we are going to have our facilities. We spend more awakened, alive time of our life, not at our home, but in the place where we work. So health and well-being and productivity is at the center of what all we do. So indoor environmental quality designing is something which is at the source of most of the great rating systems for your building. So IGBC rating system, I was part of this, and they have adopted a lot of parameters, a lot of things which you should study and have it for your hospital running, or a new hospital. But when you implement, let's say, one parameter like sound and acoustics designing, and what to design we'll see shortly. But what happens is your healing environment enhances, your patient recovery is fast, your staff effectiveness goes up, your hospital becomes safe. And these are the all parameter which can really make your hospital deliver 1.5x instead of 1x delivery right now. And it's a magic where people really enjoy being part of the team. So physical environment enhancement happens, and the sound parameters for different spaces are different. So there are parameters like background noise and reverberation time. And very shortly, I will share the case studies from Indian context. Over last 5 to 7 years, I've collected a sound bites and done the study across India, both for the hospital facility as well as the facilities which are for studying education, college block next to the hospital. But these are the parameters which are physically can be measured. You have instruments on your mobile phone can help you to understand this. I will share this with sound because it doesn't make to show you without the sound bite. So when I share this, my sound will go, but you will hear the noise level in the corridor. We will see a couple of examples, and I'll come back and talk to you. 25 decibel. Ground floor main building. Sound level 75 decibel. Or even talk at this place. We are standing at GH Hospital entry foyer. So you experience two buildings right now, one which is occupied with excessive background noise, which is how most of the hospitals lobbies are today in India. It's like worse than a fish market if you see in terms of noise levels. And other building which was under construction, ready to get occupied, almost occupied, has a double height lobby, like a hotel lobby, and everything being on a hard surface, sound is reverberating. and that makes emotions and feeling transfer in that waiting lobby area, and actually enhance whatever the background noise you have to 2x or 3x. It doesn't help the facility to really work like that. So we have a code with us in terms of how we need to have our building designed for. The next one, which I said, is education block next to the building. uh, I need to share with the sound bite again. Sorry for this from my side. This is an example.
RT study, IISCR, first floor, 110 classroom. Ceilings are gypsum fitted, doesn't give acoustics. We have best speaker on the wall, but if room is dysfunctional for reverberation, it doesn't help what speaker you and sound system you have. For such a small room of 80-seater, you don't need speaker. What you need is classroom design for reverberation time of 0.6 seconds.
This room are coming as 4. Sounds unbelievable. I do not know whether it is correct or not. 1.58 actually, which is after the treatment that we are getting this.
So these are the examples of how 3 seconds room sound, how 1.5 seconds room sound. And when the same room is treated appropriately, it sounds like you are speaking with me face to face. And this is a very critical time where students are coming back after 2 years of having virtual education in for a medical college. At times they have attended a Zoom classes, at times they have done physical thing. But now the importance of sound and acoustics is known to the teachers and student alike. So in a hybrid education model going forward, we need to enhance the quality of sound in a physical environment than ever before. In a developed nation, you cannot start a medical school or a college unless you meet zero point 0.4 seconds as a norm. In India, we adopted zero point 0.6 seconds, which is fairly good enough to start with 35 dB background noise. And our team will be very much willing to come to your facilities, help you measuring this, and implement a model classrooms. If you're interested to have a model classroom done in your medical education facility, please give your name and number. We will be very happy to work with you to develop this and change the way education happen in most of the buildings and facilities. So I would share quickly last few slides. Uh, so these are the case studies. People have used Apollo, Mumbai, which is 40,000 meter square facility. They have used wall-to-wall our solutions. Even a government and a philanthropic organization like Believer Hospital in Kerala has done modular ceiling everywhere. And as I said before, every area has a different volume and different purpose. We cannot have the same material on the floor, same material on the wall, and same material on the ceiling. We need to treat it as per the functionality. I will give you a couple of examples. Like corridor is the most important area in any healthcare facility or a lab facility where you require complete accessibility. There are hundreds of services literally running, require frequent maintenance. And if you really go for a material which is, like I showed you, is very difficult. So we have a solution in metal which can be swing down. There is no need of a trap door. You can access everything very easily. This is like application in the city of like Ahmednagar. There are many hospitals getting newly constructed and renovated are using these services. Even in a patient room, you can have certain areas which require frequent maintenance can be done very quickly and maintained regularly as you go forward. So this is a must solutions for all the hospital, mainly because there is no service entrance. The walls are supporting the ceiling, and maintenance and everything get very easily done. This is a must to have solutions in retrofit and a new facilities. This is another case study, Amri Bhubaneswar. Like I said, it has a glass on the one side, the gypsum other side, eco chamber, as I said. So the lobby area has been treated with beautiful wooden ceiling solution, which is acoustical in nature. And that has transformed this particular place. I am not going to show audio. It is take a lot of time. time here. But patient room in most of the hospital require antifungal, antibacterial, BioGuard sealing, which is allow patient recovery to be faster, and it can be wall to wall. You don't need a gypsum kind of a thing or drywall kind of a thing coming up there. You can also have design and pattern created onto the ceiling tiles. We have a solution called Ultima. You can have a hybrid solution, multiple product can come in. There is a special solutions for clean room application, aluminum grid, other things. So there is a leave my email ID number also. You can get in touch with me personally for working with your facility in coming time. Thank you, Chandan. Thanks for this opportunity to have this event and
Okay.
partner with.
Okay, you just finished. Naresh, I was so much involved into it. I thought you would be summarizing in 1 or 2 more minutes. But it is always a pleasure listening you, Naresh. You give me a surprise factor whenever you come. So in education event, you have a solution. In health event, you have a solution. And believe me, though I'm not that technically sound, nor I'm an engineer background person, but in a very simple language and the kind of way you try to understand some of the important elements which maybe an hospital entrepreneur may not understand while he was constructing that hospital or clinic. But definitely in the constructed hospital also, you do have a service and solution to transform their present services without disturbing much of their, cost and construction. That is something we look for such kind of, technology partners and solution providers. And small elements which you presented, the corridors, halls, OT area, the ICU or MRI area, we are not that equipped to understand, or nobody tells that. Matlab, hum log, generally we go to an architecture or maybe a mason who is designing your construction. He is not sound enough to understand. Let us understand ki bhai, why this voice is echoing, or maybe any serious operation which is going under an operation theater, and where you need to just whisper to your co-doctor. So what is the decibel of sound we need to speak? What sound it should, come back? So very interesting facts and figures, Naresh, you always put. And so this gives an answer to the people who would be understanding why, Knauf solution is helping and partnering with ArdorComm for this event. So, and your partner also yesterday, he explained it pretty well. So this is how we are looking for a better engagement and collaboration opportunities. Naresh, any opportunities or any interest area which comes to ArdorComm, definitely will be passing those queries to your end and your team.
Thank you so much.
Before you leave, we would like to felicitate you and honor you for the kind of work which you are doing. A small token of appreciation to Mr. Naresh Duble. He is the head of continuous improvement and marketing from Knauf Ceiling Solution. And thank you for also supporting us and helping us in being the co-powered and powered by partner for the new normal healthcare leadership summit and awards. Thank you so much, Naresh.
Yeah, I want to say only one line. Thanks for this appreciation. Is our aim is to transform the way patient healing in our hospitals and way our healthcare is provided. And human collaboratively with all the healthcare facility owners, making a solution which works from them to making their staff more productive and healing their patient faster, the reducing length of stay for every patient is our aim to transform the healthcare infrastructure. So we work with government, we work with private equally on this initiative. Just share your name and number if you want me to get in touch with you in the chat.
Lovely, Naresh.
Thank you so much.
Thank you so much.